All right, welcome everyone to this week's edition of It's Worth a Shot, hosted by Mountain Pacific Quality Health. My name is Jessie Kinsey. I'm an RN and an account manager for Mountain Pacific. And this week we have a very special guest from the Montana State Survey Agency that will be joining us, talking about the enhanced enforcement for infection control and quality improvement activities in nursing homes. Next slide, please. Updates and reminders. We have a couple things coming up actually. So next week we have the 2023 CMS Quality Virtual Conference that starts on the 1st and will run through the 3rd. And we'll drop those registration links and agenda items into chat for you if you're interested. A few highlights for that conference next week. They will be talking at a few breakout sessions. It looks like they'll be talking about restoring trust in science to build resilient communities, also advancing patient safety through patient-family engagement, and highlighting that 3rd day of the conference. They're going to be focusing on some long-term care related quality issues. And good question. Is it just for nursing homes? And I'll pull that agenda item up, but I think actually there's some pretty broad topics and breakout sessions you may find valuable if you're not necessarily from a nursing home. Also, the deadline to report the annual influenza vaccination data for at least one time for this season is coming up here on May 15th. Next slide, please. Also, updates and reminders. We did just get a heads up that there will be some webinars tentatively scheduled and registration links pending for June 1st and June 7th to go over some NHSN data entry pathway updates. Some of those updates, they did give us an overview. We'll be looking at reducing the vaccination elements that will be entered, removal of flu staffing and supply shortage data fields, removal of deaths in the staff and personnel impact pathway, removal of the therapeutics pathway, which is about due because a lot of those therapeutics haven't been viable for quite some time, but I noticed they're still in there. And then also an addition of a new field. Stay tuned for those registration links as we get them. Again, those tentative dates are going to be June 1st and June 7th. Next slide, please. As always, feel free to add your webinar topics and clinician ideas or needs into chat. We'll continue to meet every Wednesday. And we should have a polling question. Are you experiencing concerns with the cost of vaccines? Any vaccines? And if you select yes, if you wouldn't mind putting the name of that vaccine into the chat box, that would be very helpful for me. And while folks are taking a few moments to answer that chat or polling question, I did see in chat inquiry about NHSN assistance, and we can drop email address and contact information in there and provide some one-on-one assistance for you. No problem at all. Yeah, I have not seen any information as of yet what the COVID vaccine will cost when it does go commercial, which is anticipated to be this fall. When I hear more, you bet I will be sharing that forward. All right, we can close out that polling question. Thanks, Mary. Looks like the majority of folks are reporting no problem. Next slide, please. With that, our routine weekly COVID-19 snapshot it looks like we're continuing to see that trending downward for COVID-19 cases, deaths, and hospitalizations. Vaccination rate still hovering right around 16.7%. Next slide, please. COVID-19 community transmission levels, even though we're seeing that trending downward, unfortunately, we still are seeing that high transmission level throughout much of our region. So just through this map up there, be mindful. And then also I was able to track down, I know we talked about Iowa a couple of weeks ago jokingly. They actually, as of April 1st, are no longer reporting COVID-19 case or death data to the CDC. They've actually developed more of a regional dashboard to report. And I'll throw in a link in the chat too. There's a really nice article about that for those that were interested, but that would be why they're gray. Next slide, please. A few questions to follow up from last week. Question came through, do most people only need one COVID-19 vaccine now? So most of us have probably learned by now there was some COVID-19 immunization updates that came out last Wednesday. So the long short of it is most people, if you're under 65, you would, and you haven't been vaccinated for COVID-19 prior, you could potentially receive just one bivalent vaccine and be done. This may be something very helpful as we look at increasing our staff vaccination rates. Now, if you fall into the category of immunocompromised or 65 years and older, that's where you may be eligible for an additional bivalent vaccine now. So long short of it, if you're under 65, you're not immunocompromised, and you've not been vaccinated before for COVID, you may be eligible just to receive one bivalent and be done. Next slide, please. Another question that came through, and I don't know if Erica Baldry is on the line with us today, but I'll just briefly mention that a question came about for individuals who are wearing eye protection and face masks as source control as part of our COVID-19 recommendations, and they're wearing gown and gloves as part of evidence-based practice. Should they discard all that PPE after caring for the resident? This resident does not have COVID, by the way, but they comment, but due to COVID or outbreak status or community transmission, the facility has implemented universal use of eye protection and masks. Answer, should definitely be discarding the gown and gloves after resident encounters and donning new gown and gloves for the next resident. As far as the face mask and eye protection goes, it depends on the specific situation. And if you're the individual that kind of had been wondering about this question or had some more interest in this circumstance, please reach out to us. Let's discuss this in further detail and share it with your local public health as well as state epi, and we can help problem solve and make sure you're addressing it. And again, I'm not sure if Erica's on the line or not and wanted to comment on this question.
Jesse, we do have a bit more information under this question in our FAQ document that went out with a reminder.
Perfect.
This week's, it's worth a shot. So if you go ahead and open up that Word document, that's the FAQs for this week. The very last question, I believe, pertains to this, and there's quite a bit of information underneath of it.
Thanks, Miranda, for adding that. And as always, just reach out and we'll help support you and get the answers that you need. Thanks for that comment. Yeah, check out the FAQ document. All right, next slide, please. All right, so we have a very special guest, Tina Smith, with the Montana State Office of Inspector General Certification Bureau. She is the long-term care manager for that division, and we are so pleased to have her on the line today with us, taking a look at some of those infection control deficiencies, enforcement, and quality improvement activities in nursing homes. So Tina, take it away, and thanks for joining us.
All righty. Thank you, Jesse, and thanks for having me join the group. So today we're going to talk about the QSO 2310 for nursing homes, and it is the information that CMS put out as far as the new guidance for infection control. And I'm going to take care of a couple of things first before we get into that content. So next slide, please. So the Certification Bureau is part of the Office of Inspector General, and we are still located at the 2401 Colonial Drive. Our email address is still the same. We haven't changed that. It's mtssad@mt.gov. And then we have our website, which is the https://dphhs.mt.gov. So that information is what we use for basically the entire Bureau, and all of the supervisors in the office can get information directed to them by use of either that email or by that website information. Next slide, please. In our office, we have 4 supervisory staff. Todd Boucher is our bureau chief. He is going to be retiring tentatively at the beginning of June. And then our supervisory team consists of Tony Sanfilippo, who handles fire safety, and the CLIA, myself, who handles the long-term care supervision and the NATP or NATC program, and then Tyler Smith, who handles the acute and continuing care. These are our phone numbers if you need to contact us for any specific reason. And next slide, please. So today we're going to talk about the revised memorandum and the intent of that, the additions to the enforcement for infection control, how the facility may apply the enforcement, the intent of the actual enforcement itself, the revised enforcement cases, and then we're going to have some references at the end. So when looking at changes that are going to come down the chain from CMS, one of those things that I always think about is, oh my gosh, what do I need to do now? And automatically my mind goes into a crisis mode, because I have to think about, how are we going to make sure that we interpret the memorandums correctly? How are we going to distribute that information out to the public and the facilities and other organizations within the state of Montana? And so I really need to put that information into perspective, and I really need to focus on what it is that we're doing already and what it is that we're going to have to do in the future. And I have to have some flexibility with that, just like you would if you're in a long-term care facility or healthcare facility. You're going to look at the information, you're going to put it into perspective, you're going to see what resources you have, what you don't have. You need to have that flexibility to work around some situations that may be a little more challenging. But in the end, when CMS has something that comes down the chain like this, unfortunately, we're going to have to accept it and embrace it. We want to really look at who's going to benefit from those changes. And so with this new enforcement that came out, that's one of those things that I was thinking about. It's like, who is really going to benefit from that, and how are we going to put that to play in the daily things that we do? Next slide, please. So CMS rescinded memorandum QSO 2031 all, which was the enhanced enforcement for infection control deficiencies, and they replaced it or revised it with QSO 2310 nursing homes. The revised guidance is for strengthened, enhanced enforcement for infection control deficiencies, and it strengthens the actual enforcement efforts for non-compliance related to infection control. Previously, the focus was so heavy on COVID-19 that they're in a roundabout way trying to step away from that a little bit more, and their intent and the direction they're going about that is shown more in this process that they have rolled out for the new guidance. Next slide, please. The enhanced enforcement actions, they are definitely more stringent for infection control deficiencies that result in actual harm or immediate jeopardy to residents. Over the years, there has been, I would say, infection control, or F880, has been cited most frequently in the top 10 year over year over year. And so now CMS is really looking at how it is that those residents are affected and who's going to benefit again from these changes. So they're really looking at the actual harm or the immediate jeopardy. In addition, the criteria for the enhanced enforcement on infection control deficiencies that result in no resident harm has expanded. And so now they've basically joined two things together. So they've enjoined the noncompliance with infection prevention and control for F880, combined it with COVID-19 vaccine immunization requirements for residents and staff for F887. So those are for deficiencies that have no resident harm specifically identified. Next slide. The enhanced enforcement policy of QSO 2119 nursing homes was implemented early on in the COVID-19 public health emergency. And since then, CMS has continuously recognized those changes, and they have reevaluated the guidance and those things that they want the facilities to do. And they're doing that to make sure that they are having guidance that is going to reflect the current COVID-19 landscape, and they're meeting the current standards of practice. Next slide. One of those changes has been the new and emerging quality improvement organizations' involvement. We as a Bureau have worked more with the QIO over the last couple of years than we had in the years prior to that, since I started as a supervisor back in 2016 at the Bureau. Always working with the QIO in a facility in the private industry was always a benefit. And I definitely think it's a benefit now that we're working more side by side in assisting facilities in those goals. We just work in different capacities. So now the QIOs have been strategically refocused to assist the nursing homes in combating COVID-19 through efforts such as their education and training, creating action plans based on infection control problem areas, and then recommending steps to establish strong infection control and surveillance programs. And next slide. CMS is providing guidance to the state survey agencies and the CMS locations on handling enforcement cases before and after the revision of the enhanced enforcement for infection control deficiencies. So this is where I'm going to reflect on that information that CMS has rolled out in this new memorandum. And currently, the Certification Bureau, when we do a directed plan of correction, we're going to write that for a facility if they get cited for F880, anything for a level D or above. So that would be D, E, F, G, H, I, J, K, L. All of those have to have a directed plan of correction. So now is what they're doing is they're changing the process for how those directed plan of corrections are going to be required to be done. We still, as a Bureau, are going to be participating in that directed plan of correction specifically. And I'm often will work with a facility to try to ensure that we have systems that we can use together to make sure that that plan of correction is something that hopefully the facility will be able to really carry out very effectively to maintain and sustain that compliance that they're hoping to achieve. So other enforcement actions are addressed by the Kansas or Denver office. So when I'm talking about other enforcement, I'm talking about the denial of payment for new admissions, things of that nature. Anything above and beyond that DPOC is handled by the regional office, not directly by the Certification Bureau. We can make recommendations, and we do make recommendations frequently. So if you have any questions about that, just feel free to let us know and give us a call, and we'd be happy to help respond to those. Next slide. So CMS believes a facility's failure to educate about and offer the COVID-19 vaccine to vulnerable high-risk residents is a concern. Combined with improper infection control and prevention practices, this increases the residents' risk of poorer outcomes. After this last 3 years that, we've looked at the COVID-19 and we've had all these changes come about, and Facilities have really struggled and tried to maintain this compliance in this never-ending change of everything that's going on with COVID. One of those main things that CMS is really standing firm on is the protection of the resident, and the facility is expected to ensure that they have taken appropriate measures for all deficient practices, but specifically for infection control and the prevention of infection control. We still have deficiencies that we are citing where we have staff that may not necessarily be washing hands properly. They may not be doing treatments and hand hygiene properly during the treatments of wounds or catheters, things of that nature. We still have staff who are not using their PPE perhaps properly. And a lot of times that comes back directly to staff education and how frequently the staff are educated, but then more importantly, how closely are those staff monitored when they're out there actually on the floor putting those different things to work. So standard infection prevention and control practices, they apply to all nursing home residents regardless of the presence of COVID-19, whether it's suspected or confirmed if they have cases. Next slide. So the enforcement intent for CMS is to target facilities with or who are at risk for the most significant negative resident outcomes by taking a more aggressive enforcement action. And one might say, well, how could they possibly be more aggressive? There's a lot of things that CMS makes decisions on that we have no involvement in. And so when we get this information, just like you do, we have to look at it and we evaluate it and see how we can work for and with facilities as much as we can by meeting those CMS requirements. So CMS is now saying that there's going to be a shortened time period for facilities to demonstrate compliance prior to the effectuation or discretionary denial of payment for new admissions, and stronger directed plan of corrections. So currently, the Certification Bureau, if there's F880 cited on a survey, we give that facility approximately 14 days to achieve compliance. And the reason that we used 14 days is because that was recommended by CMS when we first started having to do the directed plan of corrections. And the intent with that was that CMS wanted the facilities to be in compliance as quickly as possible to stop any potential spread of infection if it was occurring in the facility. So by having that 14-day timeline already in place, that's actually a benefit for facilities, because if you do get cited for F880, you may already be familiar with what that timeline is and what that expectation is going to be. And next slide. Another part of the enforcement intent is that enforcement actions are going to be imposed on facilities when they are concurrently cited for non-compliance with infection control F880 and COVID-19 vaccine requirements for residents and staff at F887 at the level that causes no actual harm, but with the potential for more than minimal harm. So we're looking again at those deficiencies at level 2, which would be your D's, E's, and your F's. One of the things that we automatically do at the Bureau is if there is a deficiency for F880 cited, we automatically go back and we look at deficiencies that were cited on complaint surveys over the last 3 years or at recertification surveys over the last 3 years to see whether or not the facility is really sustaining that compliance that they had already achieved. And if they're not, then we want to look at possibly why that compliance is not being maintained from year to year to year. CMS would like a facility to sustain their compliance consistently and not cyclically. They don't want to see it where you have compliance and then you're out of compliance and then you're compliant and then you're back out of compliance. They want to see it ongoing all the time. Next slide. So for the revised enforcement specifically, non-compliance with deficiencies associated with infection control will lead to the following enforcement remedies. So non-compliance with both infection prevention and control for F880, concurrent with COVID-19 vaccine immunization requirements for F887, cited at a severity and scope of level 2, which would be D, E, or F for no actual harm, the following things are going to occur. Next slide. Now remember, this is two different deficiencies together if they're cited. The first thing would be a directed plan of correction, which is going to have root cause analysis required, which is the second thing that we always do. So that's part of the requirement that I already put in those directed plan of corrections, is that we really want facilities to use a root cause analysis and determine what those contributing factors are, and hopefully figure out why that non-compliance was occurring. Was it related to education? Was it related to staffing? Was it related to competencies? And we really want the facility to identify that. The second thing is the QIO involvement. So quality improvement organization or another qualified consultant for infection control is going to have to be involved. It's up to the facility to decide if you want to use a QIO or another qualified infection control consultant. It can't just be anybody. You have to make sure that that person actually has the necessary skill set, but they have to be involved to assist with not only your plan of correction, but carrying out those steps and ensuring that the facility is achieving that compliance based on those national standards, and then also what CMS has as far as their expectations. The third thing is the discretional denial of payment for new admissions. This is going to be 30 days to achieve substantial compliance. So they have moved this timeline up and you don't have as much time now. So the enhanced enforcement for F880 at the severity and scope of level 2, when F887 is also cited, so remember they're both of them at this severity level 2 for the D's and F's, additional remedies may apply if 887 is also cited at a level 3 or 4 as per the normal enforcement policy. So this is where we have a lot of deficiencies that are frequently cited for F880. We've had to do directed plan of corrections. Sometimes they don't even apply to COVID at all. Sometimes it's just a failure of a staff member to inappropriately wash their hands or, forget to wash their hands. CMS is trying to get away from having such stringent enforcement on those types of things and really focus it more down the avenue of the COVID-related type activities. Next slide. So for the revised enforcement non-compliance for F880 cited at a level 3, which would be your G, your H, or an I, which is the actual harm, and the H and the I's are considered substandard quality of care for some deficient practice areas. There's again going to be a directed plan of correction, which I can talk to the facility, and typically is what I do is I write that plan of correction up when you get your 2567 document through the EPOC system. That directed plan of correction will be available for you and we can have further conversation with it as needed. You can just give me a call. We also are going to require that root cause analysis process be used again. So that's where you want your quality assurance program to be in place and really active when it comes to your directed plan of correction. CMS is again going to require the QIO or an infection control consultant on the corrective action plan to help you ensure that you're really meeting the standards of practice and the CMS requirements for infection control. They're also going to have the discretionary denial of payment for new admissions. But please note here, it's now going to be a 15-day notice period to achieve substantial compliance rather than 30. So this is for any G, H, or I level deficiencies for infection control only, F880. It's going to be a 15-day notice to achieve compliance. And then civil money penalties could be imposed according to the CMP analytical tool. And it's a 10% increase adjustment. And you're going to see that change here in just a minute. So right now it's at a 10%. Next slide. So as your deficiencies and the severity of those deficiencies worsen, so does the actual enforcement action. It's going to become more extreme. So non-compliance for infection prevention and control for F880 at a level 4, which is J, K, and L, which are all immediate jeopardy areas. There is definitely going to be your directed plan of correction. There is going to be the requirement of the root cause analysis process to be used with quality assurance in place at the facility. Again, there's going to be the requirement that the facility is going to have to work with a QIO or an infection control consultant on the corrective plan. There is going to be a discretionary denial of payment for new admissions and a 15-day notice period to achieve compliance. And this is where we have a change now. The civil money penalties imposed according to the CMP analytical tool are going to be a 20% increase adjustment. So with that higher severity and scope level deficiency, there's going to be an increase in that adjustment for the CMP. Next slide. Deficiencies that are associated with infection prevention and control requirements for F880 are going to have the following happen. So if you were subject to remedies previously outlined in QSO 2031 all, so this is before the new memorandum came out on March 30th. If the survey start date is before the effective date of the memo, pending enforcement as a result of the enhanced enforcement will continue to be subject to the enforcement remedies previously outlined in QSO 2031 all. As of right now, all of our surveys that we have all been completed after that March 30th date. And so sometimes those directed plan of corrections, if you were cited for F880, you might not necessarily get a directed plan of correction. It just depends because you had your survey after that date. But if you had your survey before March 30th, you would be subjected to that prior QSO update and the enforcement requirements for it. So that's something where if you were cited at F880, only F880 at a D level, I would be required to do a directed plan of correction. But now, if you're cited at a D level for F880, you would not get a directed plan of correction unless you also are cited for F887. So again, they're pairing those together to make it more focused on COVID-related types of activities. So the strengthened enhanced enforcement for infection control deficiencies will apply to enforcement cases with the survey start date on or after the effective date of the memo, which was March 30th of 2023. Next slide. And now we have some resources. So the prior QSO memorandum, I have the link for that one in there if anybody needs to read it. And then the revised QSO, which is the QSO 2031 all, which was rescinded. That's available for review. You may want to take a look at those if you had surveys that were dated prior to or after that March 30th date. And if you have any questions, please make sure you give us a call and we'd be more than happy to assist in the process of explaining that. And next slide. And that is pretty much a summary of that memorandum and the new strengthened enforcement control. So there were, yes, go ahead, Jessie.
Thanks, Tina. I did just drop those links that you had on your resource slide into chat too, if folks want to snag those out of there. You should be able to see those in there now.
Thank you.
Yeah, and I was just looking to see if there was any questions. I guess if folks think of anything, reach out to us and we'll forward it on and get you answers. And there is a post presentation evaluation link as always too in the chat, and feel free to type your answers in the bottom of that evaluation. And I always look at those and make sure those are forwarded to the appropriate people. So a lot of information. I know there's a lot of changes coming. So as always, we thank you guys for tuning in, and we thank our special guest speaker, Tina, for presenting today. We sure appreciate it.
No problem. And, you know, this week they're having some meetings in Baltimore, and CMS is all together and they're having conversations, and all the states are going to be present. So there may be a lot of conversations going on related to this new enforced enhancement. And so we may end up getting more information down the road related to those conversations. And of course, if there is, we could always let you know.
Great, thank you. Well, it sounds
You're
like
welcome.
stay tuned. Stay tuned for more information.
Possibly. Yep, possibly. Thank you very much.
All right. Well, thank you, everyone. As always, thank you for attending. And if you have any questions, feel free to reach out. If you have a few moments to take that evaluation, again, the link is in our chat. We sure appreciate it. Otherwise, I look forward to seeing you next week, same time, same place. Take care, everyone.